happy World Sight Day.
Hi everybody, good morning. I'm Dr. Khor. I'm a consultant ophthalmologist in Thomson Hospital. I would like to introduce now my colleague,
Yes,
Dr. Sunder.
hi, I'm Dr. Sunder. I'm also a consultant ophthalmologist in Thomson Hospital. I also do a lot of work with children, so I do pediatric ophthalmology. Glad to be here to answer some of the doubts that will be put forward to us.
They said that diabetes can cause blindness. Is this true? What happened is, diabetic retinopathy now is one of the major cause of blindness in the world globally. So how can diabetic cause blindness? So if you can see here, the retina part, retinopathy, this is the changes in the retina causing severe blindness. So in most of diabetic patients, I think it's important to take care of their eye, must have their yearly eye checkup so that to prevent blindness. Other aspect is, besides diabetic retinopathy, in diabetic patients, they have actually higher risk of developing retinal vein blockage, occlusion, and also cataract, which is reversible. Most of them will actually develop cataract earlier as compared to the normal population, but these are reversible. But the important fact is that diabetic can cause blindness. This is very important.
Yeah,
I think we've seen so many diabetic patients coming in, and we have to do laser treatment and so on. They come with bleeding and bleeding. So
correct. Sometimes they need injections in the eye, and
yes.
if it all fails, then they need surgeries, which are very tedious. So I think the best thing to do is come for regular checkups and maintain your diabetes, and make sure it's well controlled.
Yes.
Does blue light coating on spectacles protect my eyes? Okay, this is a good question. Now, there's nothing wrong. It's harmless actually. It's just a coating of blue on the spectacle lenses. But there have been claims that blue light coating actually helps protect against retinal damage, like macular degeneration and damage to the macula or to the lens. But actually a few years ago, the American Association of Ophthalmologists came up with a statement saying that no, it does not. Now, does it protect against anything else then? Yeah, it may. It may protect against eye strain, but again, it may be limited in its value of protection. But what they do know from some research is that blue light, when it's used, helps to improve the levels of your sleep hormones. So it may help you with your sleep at night.
The other thing is blue light, and I think a lot of people, they are worried about these digital devices. And with the modern digital devices, most of them, they have actually the built-in to cut down the blue light. Okay, we have a natural blue light from our sunlight, every day we are facing it, but most of the devices, they have already a technology to cut down the blue light. But as Dr. Sunder say, it's mainly for to the hormone part, so that you sleep better at night. So, but it doesn't prevent blindness. Is it okay to go swimming or take shower with contact lenses on? So I think obviously this is what we don't want to see. What happens is the water is not clean, and in the pool water they are full of chlorines as well. So there are a lot of contamination. Even though you wear a tight fit goggles, but this dirty water can contaminate the lenses, and there'll be alteration in the shape when you go down to the swimming pool as well. So it's not advisable at all. So for our part, we say no, definitely no.
Obviously, you go into a lake, or you go into the sea or river, you're going to be exposed to a lot of organisms, and if you get an infection on your eye, it can be very devastating. You can lose your vision.
Yes, especially corneal ulcer.
Corneal ulcers.
It's a no.
So another one on contact lens. What happens if I wear my contact lens to sleep? Will they roll back behind my eyeballs and get lost? The first one, what happens if I wear my contact lens to sleep? Now that's no good, because when you wear your lenses overnight, you may be exposing your eyes to infection. Sometimes the lens may stick very much more to the cornea, and as you try to take it out, it may abrade your cornea. So for those reasons, we definitely do not encourage contact lens wear at night or overnight. The second one, can contact lens roll up and go behind my eyeball? It cannot. Okay, it can get dislodged, behind the eyelid, or it can roll up, but it cannot go all the way behind your eyeball, because there is a protective layer of tissue between the eyeball and the bony part of the eye, and that's called the conjunctiva. The conjunctiva will prevent this contact lens from slipping behind. So no worries about that. Yeah.
The other thing is why we are more predisposed to infection is when we close our eyes, temperature is higher, so bacteria is easily actually harbor in the area. And the other thing is at night, the tears production are actually the lowest. Tears actually naturally we have this property to actually kill bacteria. We have some enzyme and so on. But because of the night part, the tear production is so little, so it doesn't have the function to actually flush out the bacteria and so on. So this is one of the reasons why we shouldn't actually wear contact lens to sleep.